Vitamin B12 deficiency symptoms. Vitamin B12 deficiency is very common, and it causes an array of symptoms ranging from fatigue to forgetfulness, to tingling of the hands and feet. This is because vitamin B12 plays a principal role in numerous body functions. What does vitamin B12 do? Vitamin B12 has an important function in the production of DNA, which is the body's genetic code. DNA directs proper formation of every part of the body. Vitamin B12 also reduces homocysteine, one of the body's naturally occurring chemicals. If homocysteine is not properly metabolized because of a vitamin B12 deficiency, it may cause inflammation and toxic damage to the body. Symptoms and effects of vitamin B12 deficiency. Pernicious anemia is a type of anemia characterized by large, dysfunctional red blood cells, RBCs. RBCs deliver energy-producing oxygen throughout body to power all of the body's needs. Symptoms of pernicious anemia include fatigue, lack of energy, lightheadedness, depression, headaches, rapid heartbeat, ringing in the ears. Our nerves get damaged when there is a deficiency of myelin, which is a protective covering of the peripheral nerves. When we have vitamin B12 deficiency, myelin cannot be formed as needed. The peripheral nerves control movement and sensation of the body, and such deficiency interferes with normal nerve function. Symptoms of peripheral neuropathy, a result of damage to your peripheral nerves, include tingling, numbness, weakness. Dementia is a disease characterized by memory loss and behavioral changes. There are many causes of dementia, and vitamin B12 deficiency is one of the more recently recognized causes. Symptoms of dementia include forgetfulness, absentmindedness, problem-solving difficulties, inability to concentrate, loss of ability to take care of oneself, apathy, hallucinations. Depression is a possible manifestation of vitamin B12 deficiency, and may be accompanied by anemia or dementia. Stroke is a medical condition, characterized by interruption of blood flow to the brain, causing a physical or mental handicap. Vitamin B12 deficiency is one of the known causes of stroke among young people, who are not otherwise at risk of stroke. Less common symptoms of vitamin B12 deficiency. Vitamin B12 deficiency causes a type of spine disease called subacute combined degeneration of the spinal cord, which is loss of the protective myelin of certain areas of the spinal cord that control movement, balance and sensation. Symptoms of subacute combined degeneration of the spinal cord include weakness, numbness, tingling, spasticity, balance problems. Heart failure has also been associated with vitamin B12 deficiency. Symptoms of heart failure include fatigue, shortness of breath, intolerance of exercise, dizziness, leg swelling. Tongue swelling also result from vitamin B12 deficiency. Glossitis is the name used to describe a painful, unusually smooth tongue that can result from this nutritional deficiency. Causes of vitamin B12 deficiency. Low dietary intake. The most common cause of vitamin B12 deficiency is a lack of vitamin B12 in the diet. Vitamin B12 is a nutrient that is only found in animal products such as meat, chicken, fish, eggs and dairy. Therefore vegans are at especially high risk of low nutritional vitamin B12, as are individuals who do not eat enough of these vitamin B12-rich foods. Some foods are fortified with vitamin B12, and if you want to get your vitamin B12 through vegan foods, you have to make an effort to seek out those types of foods. Low absorption. Vitamin B12 is absorbed by the small intestine, but it requires some preliminary processing in the stomach first. Therefore, some conditions that affect the stomach or the small intestine can interfere with proper vitamin B12 absorption. Autoimmune disease, gastric bypass surgery and inflammation of the stomach are all situations that prevent vitamin B12 from being absorbed properly. Heavy alcohol use causes changes in the lining of the stomach, causing poor B12 absorption. Intestinal disease such as Crohn's disease and celiac disease can interfere with proper absorption of vitamin B12 and the small intestines, causing a deficiency even if there is enough vitamin B12 in the diet. Medications can interfere with vitamin B12 absorption. The most common medications that can cause low vitamin B12 levels include metformin, a medication used to treat diabetes; colchicine, a medication used to treat gout; chloramphenicol, an antibiotic used to treat infections. Many medications used for the treatment of heartburn. If you have vitamin B12 deficiency, many of the effects can be reversed, particularly at the early stages. In general, if your vitamin B12 deficiency is caused by a nutritional deficiency, supplements or fortified foods can help improve your vitamin B12 levels. If impaired absorption is the reason for your vitamin B12 deficiency, it is generally considered more effective to get your vitamin B12 supplementation through injections, rather than by mouth, as this allows the nutrient to enter into the body's tissue directly.